Welcome to the Bariatric program at Community and Monmouth Medical Centers of Robert Wood Johnson. This video discusses the most important dietary actions that need to be taken starting 2 weeks before surgery, 1 day before surgery, and through the first day after surgery. We'll begin with the 2-week pre-op diet. As the name suggests, this diet begins 2 weeks before surgery, and the goal is to shrink the liver in order to make it easier for the bariatric surgeon to access the stomach during surgery, which ultimately makes it safer. This diet is low calorie, low sugar, low fat, and high protein. The way it works is that your body ends up using the sugar stored in the liver for energy. And by using this stored sugar, the liver ultimately decreases in size. The contents of the 2-week pre-op diet involve 2 of your meals being replaced with a protein shake and a fresh fruit, which is either a medium piece or about half a cup to 3/4 chopped. You are allowed to have 1 regular meal a day, which consists of 4 ounces of protein, about a half cup of starch, and 1 cup of vegetables. In between your meals, you are allowed to snack on raw or steamed vegetables as long as they don't have any added fat, like from oils or dressings, or you can also have sugar-free Jell-O or sugar-free ice pops if you are feeling like you want something sweet. The beverages you drink all have to be calorie and caffeine free and also non-carbonated. The details of your 1 meal a day, which can either be for lunch or dinner, that is up to you, involves 4 ounces of lean protein, which is approximately the size of a burger patty. This involves things like chicken, fish, turkey, lean ground beef, or lean cuts of steak. You can have half a cup of a carbohydrate, which involves rice, potatoes, pasta, corn, or whole grain bread, basically complex carbohydrates. You are allowed a cup of vegetable, which is basically anything that's non-starchy. Carrots, green beans, cauliflower, bell peppers, snow peas, cucumbers, tomatoes, lettuce, celery, etc. These are also the type of vegetables you are allowed to nibble on throughout the day. The only fat you are allowed to add is 2 teaspoons of olive oil when you are cooking your meals. It is basically just to not burn the food. Beverage options include, as mentioned previously, anything that is calorie-free. So, of course, water, Crystal Light, 0-calorie water drops, fruit-infused water, Gatorade Zero, Propel, Powerade Zero, decaf coffee or tea without creamer. More details on what you can and cannot use to flavor your food. What you're encouraged to use are condiments that are naturally calorie-free, which is vinegars, mustards, lemon or lime juice, hot sauce, and any kind of dry seasonings. The list to avoid is a little bit longer. Basically involves high-fat condiments like butter, mayonnaise, salad dressing, aioli, cream sauces. Also high sugar condiments, which is honey, ketchup, teriyaki, barbecue sauce, buffalo sauce, dried or canned fruit, which is not a sauce, but also high sugar food. High fat foods, which also are a little too high in calorie for this particular diet, involves high fat meats like hot dogs, sausage, steak, ham, and then also foods like nuts, nut butters, peanut butter, almond butter, all of those, avocados, cheese, and olives. Drinks that have caffeine and carbonated are also not allowed, specifically sodas, Coca-Cola, energy drinks, sugar-sweetened drinks, caffeinated teas and coffee, though decaf is allowed. A couple of other precautions to take 1 week before surgery is to stop any supplements or medications that increase bleeding. So this includes all NSAIDs, which is basically aspirin, ibuprofen, which is Advil or Motrin, and naproxen, which is Aleve. You also want to avoid taking vitamin E and fish oil if those happen to be supplements that you take, as well as CBD. That also thins the blood. A week before surgery is also the time to start getting the house prepared for surgery. So you want to stock the kitchen with a few necessary tools. This primarily includes measuring cups, small cups and dishes, a mesh strainer, and possibly a blender or food processor if you plan to make your own pureed foods for stage 3. But mostly this is the time to purchase everything that you will need for stages 1 and 2. Now, it is one day before surgery, 24 hours. On this day, you are to begin stage 1, which is clear liquids. Now, clear liquids are anything that the light can shine through. Clear does not mean colorless. So as you can see, there are plenty of color options. However, you do have a color restriction, red and purple, which I will discuss in the next slide. So as mentioned, 24 hours before surgery, you are starting clears. Here are a few pictures just to get some ideas going. You have no volume restriction, and you want to diversify and pick as many items as you can in order to avoid monotony. So some good clear liquids include flavored waters, sugar-free electrolyte drinks, broth, stock, bone broth, sugar-free ice pops and Jell-O. You can actually have decaf coffee or tea, but you cannot put creamer in them. Also, if you have a flavorless protein powder, you are allowed to sprinkle it into these drinks. The goal of clear liquids before surgery is to have an empty stomach. You do not need empty intestines, so there are no laxatives involved in this day. Now, the color restriction for this day and this day alone is red or purple drinks and products. This is because it can look like blood during the surgery. You are allowed to do orange and blue. Green and yellow is also great. And basically, again, you're avoiding any kind of full liquids. So anything with milk, any kind of juices, drinks that have sugar in them or pulp, cream soups, of course, obviously solids. All right, the pre-surgery clear carbohydrate drink. When you go to pre-admission testing at the hospital you will be having your surgery, you will be provided this drink. It is called Ensure Pre-Surgery Clear Carbohydrate Drink. You do not have to seek out and buy it anywhere. Now, this drink is designed to control hunger and thirst before surgery, along with reducing vomiting and nausea after surgery. Also helps with glucose control for those who have diabetes. Essentially, if you drink this product, you will likely wake up feeling less nauseous, less anxious, less thirsty, less hungry, just overall less drained after your surgery. Now, depending on your bariatric surgeon, the rule of when to drink this product and how many will vary on what your doctor instructs you. For some of our patients, the rule is if you have diabetes, you will drink 1 bottle the evening before surgery. And if you do not have diabetes, you will drink the bottle an hour before your scheduled arrival time in the hospital. Now, some of our surgeons require drinking the drink both the night before and the day of, so you will receive those specific instructions at your pre-admission testing. But no matter when you are to drink this product, you want to drink the entire bottle within 15 minutes. That will make it the most effective. Otherwise, do not eat or drink anything else the day of your surgery. Now that you've had surgery, you will be taken to the room that you will be staying at for either 1 night or 2 nights, depending on the decision of your bariatric surgery. 3 times a day, you will be receiving a clear liquid meal tray from the hospital's kitchen. This meal tray essentially consists of 4 items: broth, sugar-free Jell-O, decaf tea bag with hot water, and a clear protein drink. This clear protein drink is a little bit high in sugar, so if you will try it, you do want to dilute it with water and definitely do not take home. You will also be receiving a stack of 1-ounce medicine cups. What these are for is to pace your fluid intake. So think of it as a pacing mechanism that essentially makes sure you are drinking enough, but not too much. So it is very important to utilize the GI system as soon as possible, even though you will get IV fluids for hydration. You are basically keeping it awake after surgery and making sure that there are no obstructions, which is basically any part of it, the GI system sticking together. So you constantly want to be sipping. So basically the way this medicine cup works is that every 15 minutes, you want to fill it up with either something from your meal tray or the water that is at your bedside that will be refilled by the nurses. So the goal basically is if every 15 minutes you have 1 fluid ounce of liquid, you are consuming 4 fluid ounces of liquid per hour or half a cup. Stay tuned for the next video, which describes the content of all 5 dietary stages occurring after bariatric surgery. And if you have any further questions, feel free to contact your respective registered dietitian with questions.